This is Dr. George Cosmides, and if you're watching Life Without Diabetes online program, and this is your initial kind of explanation of what it is and clearing up some myths that you've been taught about it. Type 2 diabetes, and you'll hear it more often referred to as metabolic syndrome. And are you at risk? Obviously you are, or you wouldn't be watching this video, or you have a loved one that is. Center for Disease Control, it's also known as the CDC in Atlanta, Georgia. It's an epidemic of our time, but what they're failing to let folks know is pre-diabetes and type 2 diabetes is acquired conditions. We brought that on ourselves. My father died from it, my two uncles died from it, but it was lifestyle related, not genetic. That's type 1. Here are some facts. Complication of diabetes kills more people than breast cancer, AIDS, and the treatment of it, the side effect is cardiovascular disease. But understand this, you've become unhealthy first if you're a pre-diabetic or a type 2 diabetes. You became unhealthy first. Here are the facts. Unfortunately, type 2 diabetes is becoming an epidemic, with 1 out of 3 children born today expected to become diabetic at one point in their lifetime. Unacceptable. All forms of diabetes are caused by the fact that the sugar in the blood fails to make it into the cell. When sugar builds up in the blood, you get high blood sugar or diabetes. A lot of you will know this as the A1C, which is the 3-month average, or the finger prick test. Both of them should be done. If you're overweight, but not always, you have to be overweight to have type 2 or pre-diabetes. If you're overweight, have high cholesterol and high blood pressure without elevated blood sugar, you have metabolic syndrome. If it is not addressed, it will eventually lead to diabetes. We're seeing more and more of that now. Today we'll go over what causes these problems and the solutions. Let's start by looking at why the sugar fails to get into the cell and what you can do about it. Insulin, a hormone produced by the pancreas, has a role of opening up the cells to allow sugar in the blood to pass through. If the sugar cannot get into the cell, you get high blood sugar or diabetes. There are 2 basic reasons sugar does not get into the cell. The first is a lack of insulin, a hormone made by the pancreas which acts like the key to unlock the cell door so the sugar can go through. Second, a failure for the cell to accept the insulin and then open to let the sugar in, otherwise known as insulin resistance. Insulin will not work to open the cell wall if the cell develops what it's called is, again, insulin resistance. Despite a normal amount of insulin being made, you still get type 2 diabetes because your cells fail to respond to the insulin in your blood. Remember, you became or become unhealthy prior to type 2 diabetes. Since type 2 diabetes and metabolic syndrome are not genetic, but have to do with lifestyle, that's 100% correct. You can prevent, control, and eliminate. By lifestyle, we mean what you eat, if you exercise, and how you take care of your body overall. Remember, you're going to hear this throughout this course and throughout this screen share. You became unhealthy first. Remember, to eliminate diabetes, you simply have to get the sugar that is normally in the blood into the cells by secreting more insulin or making the cells more receptive to the insulin and lowering their load by the food that we eat, which I'm going to help you to do. Why would your cells not respond to the insulin made by the pancreas? Why is that happening? To find the answer to diabetes and most other health problems you might have, you must look at your typical diet, what you're eating, and the role of your liver, your adrenal glands, and your nervous system. Again, if you're here today and don't have diabetes, we want to help you eliminate your health problems, or you're here for a loved one. If you have metabolic syndrome, insulin resistance, you're heading this direction. So you can determine what is happening with your own body. Please fill out this wellness survey. Well, we're not going to do it here. You're already taking the course. This is kind of an intro to this. Track your symptoms. If you have more than one, which most diabetics or pre-diabetics do, namely high blood pressure, congestive heart failure, the list is almost